Hello friends, today we will discuss about the maxillary nerve. Maxillary nerve is basically originated from the trigemnal ganglion or semilunar ganglion, which I have discussed in the trigemnal nerve. Basically, its courses are via from foramen rotundum. And then it enters the pterygopalatine fossa, which is basically a pyramidal shape, and then it suspends to the pterygopalatine ganglion via inferior orbital nerve. Then it enters the floor of a orbit. Then it into the inferior orbital nerve, where it gives three branches. First is palpable branch or inferior palpable branch, and the second branch is nasal branch. Third branch is labial branch. The nasal branch is mainly basically divided into two. First is posterior nasal and anterior nasal. The palpable branch basically gives to the branch to the lower eyelids. Nasal branch basically gives branches to the side of nose. In the infraorbital canal or infraorbital nerve, it basically gives two branches. This portion is termed as maxillary sinus. And the branches given is middle superior, alveolar nerve, and the second one is anterior superior alveolar nerve. The middle superior alveolar nerve will give branches to the upper jaw premolar and to the maxillary sinus. The anterior superior alveolar nerve gives branches to the upper jaw, incisors and canines, and one more branches to the maxillary sinus. Basically, the middle superior alveolar nerve and the anterior superior alveolar nerve both gives the branches to the maxillary sinus. Maxillary sinus is the largest paranasal sinus, and then we have to talk about both nerve supply of a maxillary sinus. It's given by the posterior and also gives branches by the posterior superior alveolar nerve. So there is 3 branches which gives supply to the maxillary sinus. First one is middle superior alveolar sinus, anterior superior alveolar sinus, and the posterior superior alveolar nerve. The posterior superior alveolar nerve basically gives branches to the dentine. It gives the dental branches to the molar and premolar alveolar branch to the alveolar periosteum and gingiva mucosa, and I also give branches to the mucosa branch and bony branches part of an maxilla. There is one more branches given by the meningeal maxillary nerve, that is meningeal branches. Meningeal branch of a maxillary nerve basically gives supplies to the anterior and one more branch, that is to the middle cranial fossa. In the middle cranial fossa, it gives basically branches to the dura mater. Middle, the meningeal branches or the middle meningeal branch is located. The middle meningeal branch is basically located between auriculotemporal nerve, that is a postganglionic parasympathetic nerve. A postganglionic parasympathetic nerve in which the inferior salivary nucleus gives branches to the 9th cranial nerve. In this, the postganglionic parasympathetic nerve, it basically gives supplies to the inferior salivary nucleus, where it will give branches to the 9th cranial nerve, then to the otic ganglion, and then to the auriculotemporal nerve, which gives supplies to the parotid gland. There is the branches, another branch arises up, that is known as auriculotemporal nerve, which gives branches to the parotid gland. Orbital nerves, when it goes to the interior orbital fissure to the zygomatic bone, it gives basically 2 branches, zygototemporal and zygomaticofacial. The zygototemporal gives branches with the lacrimal nerve and gives supply to the lacrimal gland, which is behind the eye. If I show the figure like this, here Here this is the V2 branch, then it goes to the nose as the labial branches, nasal branches, and then it goes to the palpebral branches. It gives branches to the posterior, anterior, and the middle superior alveolar branch will give supplies to all the dentine structures of premolars, molars, incisors and canines. And from there only the auriculotemporal nerve gives branches to the ear. Study about its clinical portion. The first clinical is basically related to the auriculotemporal nerve, that is Fries syndrome. Fries syndrome. Fries syndrome is also called as gustatory sweating syndrome or called as sweating syndrome. It is basically due to the injury to the auriculotemporal nerve during periodictomy, where there is a surgical removal of a parotid gland occurs, and in this there is regeneration of auriculotemporal nerve occur, which basically innervates sweat gland instead of a parotid gland. So there is a large secretion of a sweat gland occur or sweating occurs. During regeneration, the two nerves joins with each other, and auricular nerve, great auricular nerve, rejoins with each other, and while eating there is a drop of a perspiration appear over skin of parotid gland or over cheeks. The second is the loss of a sneeze reflex. Sneeze reflex. Whenever there is a injury to the maxillary nerve, then there is a loss of a sneeze reflex. This branch is the afferent branch of an afferent branch of sneeze reflex, and the efferent branch of a sneeze reflex is nucleus ambiguous, and respiratory center is medulla oblongata, and the phrenic nerve nucleus, and the motor cells of spinal cord of intercostal muscle.
Air to rid the nasal passages of foreign material. Particles that enter the nostrils and irritate nerve endings in the nasal mucosa trigger impulses that are transmitted via the fifth cranial nerve to the brain's sneezing center in the medulla. This sets off a respiratory response. Rapid inspiration fills the lungs, the epiglottis and vocal cords close, and the muscles of exhalation in the chest and abdomen tighten in a spasmodic contraction. These events create a buildup of pressure in the lungs. When a sufficiently high level of pressure is attained,
Learn how does the sneezing reflex occur. Thanks, like, subscribe to our channel and comment.